Today is all about coming up with an easy solution to a really hard problem. We're talking about erectile dysfunction on the Exam Room Live. And welcome to the show, everybody. I am the weight loss champion, Chuck Carroll. Thanks so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And yeah, we are talking about erectile dysfunction, an exceedingly common condition and a frustrating one at that. And we are going to be joined today by Dr. Robert Ostfeld. He is the Director of Preventative Cardiology at Montefiore Health System up in New York. And we're getting together on this special Exam Room Live to talk all about erectile dysfunction. So let's not waste any time. Let's get right into it. Dr. Ostfeld, welcome back to the Exam Room Live, my friend. Thanks for being here.
Chuck, thank you so much for having me. It's an honor to be here with you on the Exam Room podcast and to be here with your listeners. And I'm a huge fan of PCRM's work. So thank you.
And we are a huge fan of yours, including the studies that you have going on right now. We're going to be getting into those in just a little while. But let's begin with this extraordinary abstract that you just presented on, one that is believed to be the first documented case of a man fully reversing erectile dysfunction by adopting a whole food plant-based diet. This is exciting stuff, Doc.
Well, thank you so much. We were so pleased to be able to present this abstract at the American Society for Preventive Cardiology meeting that was just like 2 weeks ago in Salt Lake City. And to my knowledge, there's not been another case published. And anecdotally, I know many of the physicians and other healthcare professionals in the group here have likely had experience with people's erectile function improving after adopting meaningful lifestyle change, but I'm not aware of a case having been presented. And so ours was presented as an abstract, and we are now, I was actually just 15 minutes ago, working on writing it up so that we could submit it to an academic journal, hopefully for publication.
I think that a lot of people will have a keen interest on that, so I appreciate you kind of giving us the leg up on this one. Let's walk people through this case, and as we do that, by the way, if there's a question that you have for Dr. Ostfeld, post it in the comment or in the chat. We'll get to as many as we can when we open up the doctor's mailbag. So, Dr. Ostfeld, in this case, this lucky gentleman was 52 years old and had heart disease. Kind of walk us through what you saw here in the course of treatment.
Yeah, so he kind of presented to us after much of this had already occurred, and we were more in the information gathering mode, and he really had reaped the benefits of the incredible work of Doctors Furman and Esselstyn and Barnard over the years. So we have a cardiac wellness program here at Montefiore. And we have a new office in Manhattan West, right near Madison Square Garden, where we're seeing patients as well. And so this is a gentleman who saw me there maybe about 6 or 8 months ago. And he came in for routine cardiovascular care. And so he had cardiovascular disease. He had a long-standing history of high cholesterol, and he even had a coronary stent placed. Stent is when we can go into an artery in the heart and open up a blockage with the stent, so to make a blockage that may have been 70% and move it out of the way and make it 0%. But he had a stent placed in 2021. And when he came to see us, he was feeling pretty well. His blood pressure was around 110/70, and he was overweight, but not obese. And his physical exam was unremarkable. He had a pretty good functional capacity. He could exercise 45 to 60 minutes most days of the week, not super intensely, but was not having cardiovascular symptoms with that. But in the course of the conversation, it became clear that since about 2019, he had fairly significant erectile dysfunction. And after his stent, well, I should say erectile dysfunction is the inability to achieve or maintain an erection satisfactory for sexual performance. And there's a number of things that can cause that. But in the Western world, the most common one is vascular disease, the same kind of cholesterol blockage disease that you see in the heart, same kind of thing, but affecting the artery to the penis. And so we know that this kind of disease, atherosclerosis, it doesn't just affect one artery or one part of the body. It's a systemic disease, and it affects the blood vessels throughout the body. So it's no surprise that if someone has coronary artery disease, there also may be some degree of erectile dysfunction. And we actually, there's about 60,000 miles of blood vessels in our body. So it's no wonder that if you eat and live healthfully and we treat our blood vessels healthfully, we'll treat every square millimeter of our bodies healthfully. But this patient really was kind of, in some respects, textbook, because he started to notice erectile dysfunction at around 2019, perhaps a little before. And we call erectile dysfunction the canary in the coal mine for heart disease, because heart disease typically presents 2 to 5 years after someone presents with erectile dysfunction. Why might that be? Well, the artery to the penis is smaller than the arteries to the heart. So by the time you may have a blockage in the artery to the penis that's impacting erectile dysfunction, it's quite possible that you have a blockage or disease in the blood vessels that feed your heart with blood, but have just not yet clinically manifest. Coronary artery disease or blockages in the heart and vascular erectile dysfunction share the same risk factors, the risk factors that we are all very familiar with: high blood pressure, high cholesterol, diabetes, obesity, inflammation. So they walk together, unfortunately. And so erectile dysfunction is extremely common. 70% of men over 70, from some reports, have it. 15 to 20% of men over 40 have it. But I suspect it's more common than that for two reasons. One is that people don't like to talk about it for obvious reasons, which is unfortunate, because if you start to notice it, it's a great opportunity to turn things around in terms of health and lifestyle and medications when needed. And also because the study that's commonly used to quote the frequency of erectile dysfunction is fairly old at this point, over 20 years, when risk factors may have been slightly better controlled, less obesity. So I think it's more common, I think largely because people don't want to talk about it. And so, but our patient had it starting in 2019. And up until that time, he had said he had eaten fairly healthfully, mostly plant-based during the week. But on the weekends, he would kind of not be on the wagon at all and have lots of meats and snacks and sugar cookies and processed things. And so basically off the wagon for a solid at least 48 hours every week. But so in 2021, after he had his stent placed in his coronary artery, he adopted a whole food plant-based diet. And after that, he started to notice that his erectile function was improving. And it was improving and improving. And it went from moderate. There was actually a questionnaire, a validated questionnaire, the IIEF score, International Index of Erectile Function score, we can use to assess the degree of erectile dysfunction. And his went from moderate with a score of 9. And then after that, he adopted a whole food plant-based diet. And within about a year or so, it went from a score of 9 from moderate to 20, which is mild. And I should say it's from 5 to 25 is the range. And so he went from moderate to mild. And then at that time, he went from whole food plant-based to adding an additional 3 or so servings of greens a day. This is in the mold of Dr. Esselstyn. So he was having 6 servings of green leafy vegetables every day. So whole food, plant-based, 6 servings of green vegetables every day, and his mild ED completely resolved. And by about 8 or 9 months later, he had completely normal sexual function. And I should say, we didn't change any of his medications. We didn't use any medications to improve his sexual function. He didn't take any, hormone replacement therapy or anything like that. His erectile dysfunction was from vascular disease, had no history of any kind of hormonal abnormality or neurologic or abnormality or trauma to the area. So it was vascular ED, and without the use of medications specifically for ED, with meaningful lifestyle change, he went from moderate ED to completely normal erectile function.
That's huge. And I'm looking at the timeline here, and it looks like he achieved that normal sexual function in February of 2024. So a very happy Valentine's Day indeed. I'm curious, a couple of things that I want to ask you about. Number one, the supposedly healthy diet that he was on, and then he would go off the rails on the weekends. But let's look more closely at that healthy diet. I'm going to put that one in quotes. Were you guys able to glean exactly what the primary diet was that he was eating during the week? In your estimation, was that actually a healthy diet, or was the damage being done by those weekend benders?
Well, I think that he had some damage from years and years of not really having a super healthful lifestyle. I think before 2000, now some of this is obviously through the retrospective scope, but before 2011, I don't think he was particularly focused on diet or the diet at all. And so had a typical Western diet. And so starting in 2011, he started to eat a little more healthfully, more vegetables, fruits. But I don't have more specific detail. Based on my judgment. I don't think that the Monday to Friday was, like rock star whole food plant-based diet. I think it's probably was healthier, much healthier than the typical Western style diet. But I don't think it was, say like an Esselstyn or Barnard level whole food plant-based diet. I just think it was a lot healthier. And then as his disease process unfortunately progressed, he then started to really embrace a much healthier lifestyle and really has seen incredible benefits.
By and large, let me ask you then this, generally speaking, as a cardiologist, a lot of us are kind of weekend warriors at the table where, we have the cheat day of all cheat days where we give zero cares to kind of censor myself there about what it is that we're eating. How much damage can actually be done in just a 48-hour span if we continue to do that week after week after week? Yet during the week, we actually do eat a very clean diet.
Well, look, every little bit counts with a healthier diet. There's any number of prospective cohort studies that show for like every quintile or decile you increase with a more healthful dietary pattern, you have more improved health outcomes. So we don't want perfection to be the enemy of good. And some people, they can go 70% of the way there and that's it. And hey, I'll take it. So I don't want perfection to be the enemy of good. And certainly from American College of Cardiology and American Heart Association guidelines, a predominantly, but not exclusively plant-based diet is completely supported to protect cardiovascular health. If you look at it on a societal level, like something like 75% of the US consumes in a poor diet, and 0.7% of the US consumes a quote ideal diet. So that gap between where we are and where we could be, it's a crisis. And your podcast, PCRM, and many others are working so hard to bridge that gap. But since like people fight and scream and yell about which is the super duperest greatest diet of all time ever on a societal level, in my opinion, total distraction. 75% eat a poor diet. So like, I would, but so they in this study that I'm mentioning, published in the Journal of the American Heart Association by Bundy in 2021, they also estimated that if everyone adopted an ideal diet, and I'll define what an ideal diet is in a second, an ideal diet, cardiovascular event rates would fall by 42% after 1 year. Like, that's a pretty big deal epidemiologically. So they defined an ideal diet as consuming 4 or 5 of the following each day, or 4 or 5 of the following: at least 4.5 servings of fruits and vegetables a day, at least 3 servings of whole grains each day, low salt consumption, low sugar sweetened beverage consumption, and fatty fish consumption twice a week. That's how they define it. So if you had 4 or 5 of those, you were considered, quote, ideal. And that kind of dietary pattern is aligned with American College of Cardiology guidelines. So we're really far away from that. But certainly we know that one unhealthful meal can worsen endothelial function, worsen blood vessel function. But then after 6-8 hours, it wears off. But I do think chronically you are, you're giving repetitive injury to the blood vessels. So particularly in people with vascular disease, the closer you can get, I believe, to a whole food, plant-based diet, getting rid of the junk food, not falling off the rails, is going to substantially improve your health. And there's any number of case series, Dr. Esselstyn's case series, Dr. Barnard's randomized controlled trial, Dr. Ornish's randomized controlled trial that support that contention. So, yeah.
Yeah, man. I'm curious about the fatty fish there being recommended in the ideal. We have somebody in the chat also wondering if that was probably for the omega-3s there. Would that be your guess?
Well, I think it's in there because the majority of the big randomized trials looking at cardiovascular prevention are Mediterranean-style diets. They're big, the PrediMed, the Lyon Heart Study, the CardioPrev. These are thousands and thousands of patients followed long-term. And the guidelines like that because they think it's going to give them very strong and useful information. And so what they did in those studies broadly is a Mediterranean-style diet versus a more Western-style diet. And not surprisingly, a Mediterranean-style diet, which is predominantly plant-based, did better. And there's any number of studies to support that. Of course, PCRM pitted a vegan diet versus a Mediterranean-style diet in 99 people for 22 weeks, I believe. And I think that maybe I might be conflating 2 of your studies, but found that in the plant-based arm of that randomized trial, multiple metrics improved: lower cholesterol levels. I think they lost more weight, but blood pressure actually did improve more in the Mediterranean arm. So the reason they have the fatty fish consumption is because that is part of the Mediterranean-style diet, which overall is quite a healthful dietary pattern compared to the Western world diet. Because it's predominantly plant-based. So whether it's healthful because of or despite the fish is a matter of some contention. That's even discussed a bit in the American College of Cardiology guidelines. There are a few studies, epidemiologic studies, that look at if you take fish out and you replace it with plant-based protein, is it healthful? Is it not healthful? And it appears that replacing it with plant-based protein or plant items is more healthful. There's that study by Dr. Song. There's the post hoc analysis of the PrediMed study and a couple of other epidemiologic replacement studies that support that. But these are post hoc and epidemiologic studies, so they're helpful and hypothesis generating, but not necessarily, causative. So the guidelines have settled on a Mediterranean-style diet, but do support a plant-based one. So I think that the fish is in there because it's part of the Mediterranean-style diet, and possibly because, just like you said, mechanistically, the omega-3s.
All right, let's pivot back to the ED study. Now, you mentioned that the gentleman, for the majority of his life, didn't really care too much about what it was that he was eating. It was kind of ad hoc, and it was just gimme that standard Western diet. Which brings us to a question from ET. I believe it's Extropian Transhuman. We'll call them ET because that's easier to say. In the chat, said, "My parents say that it didn't matter what you eat." As a kid because you weren't an adult yet and you only get the health issues as you get older. Just paraphrasing here. That whole line of thinking as a cardiologist, and in this gentleman's case, who you covered in the abstract, is that kind of alarming and, as ET said, kind of bogus?
Yeah, I agree. All those words count: depressing, alarming, bogus. Like you're like helping to keep cardiologists employed. So, um, there are any number, like there is an interesting pathology study of kids 12 to 14 years of age in the US who died from like trauma or something. And they looked at their coronary arteries, and fully 65% of them had very, very early signs of atherosclerosis. This is a disease process that starts very, very early in life. I think Esselstyn has even said, when you graduate high school, you get a diploma and you get coronary disease. It starts very early. There are very famous pathology studies of Korean War veterans and Vietnam War veterans. These are our U.S. soldiers who died at the prime of life, 19, 20, 21 years of age. And depending on the study, there's between 45 and about 75% of them had overt coronary artery disease. So this is a disease process that starts when we're very young. There's any number of studies that show that when you have risk factors when you're young, obesity, high blood pressure, high cholesterol, that negatively impacts your 15-year-old self will negatively impact your 45-year-old self. So having that kind of healthy lifestyle early on is great. If the long, like we look at some risk factors kind of like area under the curve. Like the longer you've been exposed to high LDL or whatever, the worse it is over time. So if you're, being healthier sooner is going to be in your interest. So it's depressing, and just help us put cardiologists out of business.
All right, I guess that's a good news, bad news situation for you there, Doc. Let's talk about your study here in just a little bit. How, I guess, if you want to look at it that way, you're trying to put yourself out of business. But first, let's call back to maybe one of the first interviews you and I did together, where we went down the most popular foods in the standard American diet and whether or not they cause erectile dysfunction. And I think that we went 10 for 10 that day. So when we're talking about foods that are likely to cause ED, what are some that continue to be at the top of your list?
Well, I think like we talked about, there's the ED starter kit. And, it's the foods that you and your listeners are very familiar with. There's the category particularly of processed meats, I guess like a salami or a bologna type. Those kinds of highly, highly processed meats are particularly unhealthful in general and not helpful for erectile function. The, ultra processed junk foods like sugar cookies, the chips, things like that. Sugar sweetened beverages are not going to be helpful for vascular health in general. And there is, interestingly, randomized controlled trials of the Mediterranean style diet, which is predominantly plant-based, versus a Western style diet in people with erectile dysfunction by Esposito. And those studies demonstrate that when you're eating more plant-based, more vegetables, fruits, fewer animal products, you do better from an erectile dysfunction standpoint. So I would say highly processed meats, in particular, I believe that red meat as well is going to contribute to it. The processed snacks, sugar sweetened beverages.
All right. BLS, we'll call them that for short on YouTube, is wondering what the exact mechanism is on processed meats like salami impacting ED. Is it the cholesterol in there getting in and clogging up the arteries?
Part of it is instead of what, right? So that's the first thing. So if you're eating that, like you're not necessarily having more healthful beans or lentils. So you're trading that for something that could have been, or consuming something that's unhealthful and not consuming something that's healthful. So instead of what is number one, then indeed it's multifactorial. It connects. So these kinds of ultra processed foods may negatively impact the gut microbiome, may promote inflammation by a variety of different mechanisms, can increase LDL cholesterol levels because they're going to be higher in saturated fat. And yeah, so and those kinds of mechanisms would contribute to it. And we know that even one unhealthful meal can worsen blood vessel function and may impact, which could conceivably negatively impact erectile function.
All right. Really quickly, Mona in the chat is wondering whether the exam room changed from being live on Wednesday to Monday. No, this is a one-time special thing just because we've got the man, Dr. Robert Ostfeld, with us. But rest assured, Mona and exam roomies, we will be back live again this Wednesday and every Wednesday thereafter. We've got Dr. Neil Barnard coming up on Wednesday. We're going to be talking about the connection between red meat and colon cancer rates increasing among younger and younger people. A study just dropped recently we're going to be talking about. Absolutely fascinating, eye-opening, and really kind of depressing research, but we got the power to reverse it. Kind of like Dr. Ostfeld, what you're talking about. We've got a lot more power than we think to reverse erectile dysfunction. By the way, I have seen estimates all over the place for how many people have ED, anywhere from like 7 to 70 million. What do you know in terms of how big of a problem ED is?
Well, I mean, from my perspective, it's quite a big problem. And, you know, I'm a cardiologist, so I will see people who are enriched with vascular disease or have a variety of risk factors already: high blood pressure, high cholesterol, obesity, diabetes. Maybe they already have some kind of vascular disease, had a heart attack, stroke, something like that. So I see a sicker group of people on average. But I mean, so I think it's underreported. I think it's extreme. The older we get, the more common it is. I think over 40, the rates are going quite high. People just don't want to talk about it. So I think it's a very big problem. And if you think about high blood pressure, for example, which is an extremely, unfortunately, common risk factor. If you're a 50-year-old adult in the U.S., according to Framingham data, your lifetime risk of developing high blood pressure is about 85%. Like, that's just, I mean, whenever I read that number, I have to re-look at it. It's just so crazy. It's so high. And if you compare that to, say, the Tsimane people, that's an indigenous population that lives in the jungles of Bolivia, and they have more subsistence living. They are quite physically active. Their diet is much more whole food. It's about 72% carbs, but it's truly whole grains. 14%, I think, fat, and 14% animal protein. Like, they're catching really wild animals. And they even have a little more inflammation than the average person because they've got some infections. But there, if you look, this is off the top of my head. It was published in Lancet in 2017. But the percentage of people like over 70 in that population, in this cohort, or this cross-sectional analysis of them, there was probably about 60 or so people in this cohort that were over 70, and like 8% of them had high blood pressure, compared to 85% of us. I mean, it's just remarkable. And I think,
Wow.
that's primarily lifestyle related.
Wow.
So, since those risk factors are so common in the Western world, and they're bad for your heart, they're bad for your brain, they're bad for your health in general, and they're also bad for erectile dysfunction, I think that erectile dysfunction is way more common than we talk about.
All right. Now, if somebody's coming to see you and your brand new offices there in Manhattan West, I mean, just beautiful. I had a chance to tour them at the grand opening. I mean, state of the art, just lovely, lovely offices, as you said, right by Madison Square Garden. And they come to see you, and they've been eating a lot of the bad foods we've been talking about. But you get out your prescription pad for ED, and instead of writing down the prescription for the little blue pill, you scribble down some of those whole food plant-based items for them. What are some of the ones that you would put toward the top of your list?
Well, green leafy vegetables are the cleanup hitter, the star quarterback, the Stephen Curry of basketball, so that's my number one go-to, the green leafy vegetables. But what I will, if when I see people, will take a full history, and sometimes people have non-vascular reasons to have ED, and we'll explore that. But we'll walk through why the healthier lifestyle will be beneficial for them. And I have some handouts that I give people that we tailor specifically to the person. And in general, we're looking for lots of green leafy vegetables, fruits, whole grains, beans, lentils. We also get into exercise. We discuss sleep, oral health. So it's kind of comprehensive. But from a dietary perspective, if I had a list like 3 or 4, it's fruits, vegetables, beans, and lentils.
As ET says, then maybe perhaps blueberries could become the new little blue pill.
Yeah, hey, that's a good one. I'll have to remember that.
Yeah. So really quickly here, and then I want to ask you about your study. But listen, man, I gotta know. Based off of everything that you said, I think I can hypothesize this. But the eggplant emoji gets thrown around when we're talking about things like this. Are you actually inferring here that eggplant could actually be beneficial for erectile dysfunction?
Yeah, that's a good one. It's really quite a versatile plant. It is both visually representative, so it's really done us a service in that regard, and it's healthful in that regard. So it's really a utility infielder for the sports analogy. And I should say, with our clinic, we for years and years and years pre-COVID, we had these 5-hour Saturday morning sessions where we would teach people the how and why of plant-based nutrition. And but we had to press pause with that, obviously, with COVID. And now we have resumed them virtually. And I work with Lauren Graff and RD, and we have them virtually now on periodic Saturday mornings. So patients who come and see us, whether in the Bronx or at the Manhattan West site, they're able to come and join for those sessions.
Yeah, that's 2 baseball references. The sports guy in me is wondering if you're Mets or Yankees.
Oh, well, I'm a Yankee fan. My dad took me to the World Series way back when Reggie Jackson was the star.
Wow.
So that's like baked into my soul.
Mr. October. I'm a Mets guy, but I won't hold that against you. I'm a Mets guy. All right, let's talk about this study that you're doing because you're actually really, for us fellas here, doing the Lord's work, Dr. Ostfeld, and you're starting to learn more and more. You want to learn more about ED, the causes, and things like that. Talk to us about these studies that you're running.
Well, anecdotally, we've all sort of seen patients who adopt more plant-based nutrition have a variety of improvements, including erectile function, as exemplified by our case report. But, we thought it would be great to study that a little bit more. So we have 2 randomized controlled trials going on, to my knowledge, both of them unique. And we are looking at the impact of dietary pattern on erectile function in young, healthy men with normal erectile function and randomizing them. Each study is slightly different. We can get into the nuance, but basically randomizing them to plant-based meals or animal-based meals, measuring their erectile function after that with an FDA-approved device called RidgeScan. And I know it's sort of like a PG-13 conversation, but the study is totally G-rated. And so we measure their erectile function. Then they cross over, those same people. So if you started with the plant meals, then you eat the animal. If you start with the animal, then you eat the plant. And we measure their erectile function again, and we compare them to each other to see, does consuming one dietary pattern or another impact erectile function. And our hypothesis is that consuming more plant-based meals will beneficially impact erectile function, but we don't know unequivocally because we're doing the study. It's not done. And we also think, just like you were saying, that let's say we show that plant-based nutrition improves erectile function, that may also prove to be uniquely motivating to help people adopt behavior change. Like I could see a 25-year-old guy in clinic and I could be like, hey, if you eat more plants, you may be less likely to get high blood pressure when you're 40. Like, but if I say you're more likely to have a better erection tonight, that may get more attention. So that's part of the motivation to help with behavior change, but we'll see what it shows. And we'll go from there. And it's sort of similar. If those have seen the documentary film, The Game Changers, it's kind of similar to that.
So you say get a better erection tonight. How quickly do we think these changes can occur when somebody begins to eat that healthier diet? Is it like we saw in The Game Changers? It really can happen in the span of just a few hours?
That's the hypothesis. We don't unequivocally know, but there have been studies looking at other arteries, like the artery in the arm, the brachial artery, where having a healthier diet led within just a couple hours to improved blood vessel dilation, increased flow-mediated dilation compared to an unhealthful diet. So there's that. There's the Game Changers, where they saw it wasn't really done in a study kind of way, but kind of just an interesting proof of principle. They saw it there. So that's really kind of all we have to go on. There's not a lot of data out there. So we had to really kind of, we like to have it all sort of be evidence-based, but in this case, it had to be, quote, eminence-based, how to figure out how to design it, because there wasn't anything to go on. So we think so. We think, yes, within just a couple of hours, you can see improvements in vascular function.
That's huge. And let's do something very modern. Pull up your Instagram there. There's a QR code for those of you who want to scan that and register for the study. We also have a link to that down below in the show description and in the episode notes. What's the criteria for participation here? Who's the ideal participant?
So I should just say we also have, that's our second erectile function study that just launched like 2 weeks ago. And we have one that's about 10 months old, which I'll forward over to you. Hopefully you can put in the notes.
Absolutely.
As well. And the phone number there and the email address work for both studies. So erectile function 1, erectile function 2. And we're looking for young, healthy men. And so for our first study, it's healthy 18 to 35-year-olds. And the second one is healthy 18 to 32-year-olds. And basically we're excluding people if they have pretty much any medical diagnosis. Like you could have asthma or osteoarthritis, but if someone has heart disease or diabetes or high blood pressure, something like that, we are excluding them. It's meant to be a healthy population in this proof of principle kind of studies. So that's what we're looking for, young, healthy men. And people are reimbursed for it. If you complete the study, erectile function 1, you're reimbursed up to $350, and erectile function 2, I believe it's $250 because it's a slightly shorter study. So we're pretty excited about it. For our first study, we're going to enroll 46 people. We have 14 people so far who have completed it. And for the second one, we've just started to screen people. So no one started the study yet, and that's going to be 30 people.
Gotcha. All right. Well, we'll get the links off to the ED1 study down there for you as well. Right. Just out of curiosity, why again are we looking for healthy individuals here?
Well, because we thought that the intervention, the meal that we're giving people, it's a short period of time. In erectile function 1, it's basically 4 meals in a row, and erectile function 2 is just 1 meal. And so we thought, and this is again kind of eminence-based medicine, we thought that if someone was reasonably healthy, their endothelial cells will be healthy and better able to adapt to these kinds of short-term changes. But if someone is enriched for vascular disease, we thought it might take a little bit longer to impact or change, improve their blood vessel function. So that's why.
All right. Well, listen, we got to leave it at that for today. But thanks for your time. Again, links to everything are down below. Dr. Ostfeld, you are a wealth of information, my friend, and a hope to millions who are suffering from this wretched, I'm going to call it a disease because erectile dysfunction just plain sucks, Doc.
Yeah, it really does. It impacts obviously more than just medical. There's major psychological and lifestyle components to it as well. So I appreciate you highlighting it. And showing how the things that we already know are helpful may very well be helpful also for erectile function. And Chuck, it's always a great honor to be on the show with you and to be able to speak to your listeners.
Hey, the honor is all mine. And listen, keep October 5th open, all right? We're going to be doing a show up there, I believe at the Thalia Theater. Dr. Barnard and I will be up there along with Chef Dustin Harder. So if you're free, man, we'll roll out the red carpet for you.
All right. That sounds hopefully with lots of raspberries and strawberries sprinkled all over it.
These are the fact, and the new little blue pill. I'm sure we'll find some blueberries to give it a little pop of color as well. Dr. Ostfeld, thanks, my friend.
Thank you.
That's the guy. All right, for everybody here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thanks so very much for raising your health IQ with us. We will talk to you again very, very soon. But until then, keep it plant-based.